Nene is vision impaired, but her condition can be treated. Nene is an indigenous woman from the Mamanwa tribe of Surigao del Norte in the Philippines. And like her, thousands of indigenous people need access to eye care. Many factors explain why people like Nene remain blind. Many indigenous Filipinos live in remote and isolated areas. Economic opportunities and social services like healthcare are often lacking in the places where they live.
The Fred Hollows Foundation is an international eye health organization that aims to end avoidable blindness. Our founder, Professor Fred Hollows, believed that all people, including the poor and marginalized, have an equal right to health services. He brought eye health closer to Indigenous Australians, and the foundation he started is doing the same here in the Philippines. We are working hard to make sure that Indigenous Filipinos are able to access quality eye health services.
Jonalyn is a nurse serving the indigenous communities of Negros Oriental. She works with the National Council on Indigenous Peoples, or NCIP, and has helped hundreds of people receive proper eye care. Many of them got their eyes checked for the first time in their lives.
Our strategy is to partner with institutions like the NCIP to ensure that our programs are sustainable. We also train nurses and tribal health workers in eye health and vision screening. By educating Indigenous Filipinos, we are empowering them to take charge of their own eye health. We have also created local communication campaigns to spread eye health messages. The messages encourage positive, health-seeking behaviors, and the materials were co-created with Indigenous representatives. By listening to and using Indigenous voices, we are able to elevate the platform on which eye health messages are delivered.
Harid is an indigenous leader who had cataract and had his sight restored. He leads 649 indigenous families. When he goes back to his community, his story is a testament that in most cases, blindness can be prevented if detected early. In fact, 9 out of 10 people who are blind or vision impaired don't need to be.
We have encouraged Indigenous leaders like Harid to show the importance of eye health to the broader Indigenous community. When trusted leaders like him encourage people to use eye health services, the community learns that eye treatments like cataract surgeries are available and they do work. With the help of government and corporate partners, we have also reduced out-of-pocket costs for expenses like transportation and food. These expenses often deter people from seeking treatment, and by providing financial support, more Indigenous people have been able to access eye health services in the 6 eye centers we have set up.
Restoring someone's sight is a long journey. It involves building strong partnerships, gaining the trust of communities, and investing in education and training. It means working together to remove the barriers to access culturally appropriate healthcare services. But it all comes together when patients like Nene have their patches removed and they can finally see again.
Kita na ko, Dok.
Ilan ni?
Duha.
Kani?
5.
Kani?
3. Isa.
Uyab. Gwapo.
Now, Nene can better contribute to her community. Once blinded by cataract, Nene can now see again.